Um, Hi, Pamela. I just want to say hello to you because you just joined. Don't know if I've missed anybody else. Nope. So let's make a start. And I'm going to hand you over to the wonderful founder, Wendy.
Oh, Cheryl, thank you very much. I'm so truly excited, actually, this morning. I've been looking forward to this. It is afternoon, but it looks like in the morning because it looks as if it's going to start raining on this side of the world. Would it be nice for all of us to put our camera on, if I may ask, because it would really be nice. It's quite a small group. It'd be nice to put those faces and the names on virtual connection. It would still be nice to see our faces when we meet. Hopefully, when all those the pandemic decides to let us get on with our lives. So it's really nice to meet you today. And just like Cheryl had said, without diversity Q, I'm not sure where we would be today. So a very big thank you to Cheryl and Lawrence and coming on board to move this vision to the next level. And for some of you that do not know, just to quickly introduce myself, I am Wendy Olaiwola. In my day job, I'm the National Maternity Lead for Equality within the NHSE, and I. Um, Very close to the chief midwifery officers, working closely with her. So on for the hat that I am wearing today, I'm a visionary for this awards, and it's such a dream coming true, really, to bring this award to fruition. And this is our third year running, and as you may know, why we or may not know the reason why this award was created. It was created basically to recognize the achievement, of the ethnic minority, the Black, the Asian, and other people that actually feel that they're experiencing work discrimination or lack of career progression. And as we all know, that we do great work out there, but when it comes to recognition and acknowledgement, we are not always at the top of all those, national awards. And so we have our own national awards to basically acknowledge that. It's also a national framework for leaders and champions, including ourselves, people that looks like us, for and also to improve equity and to improve equity and also to acknowledge those that are serving those diverse communities, the different communities that we come from. And it's also, like I said, it is to improve our career progression as well. Hence, we are here today. And it's not just an award of trophy, really, I must say. That I think that is the uniqueness of this award. That it's not just about that celebration alone, but also to focus on our career progression. How do we move from level A to level B? And we all know the challenges, that we all face, through our journey. I'm sure everyone has a story to tell, and so do I before I get to where I am now. I'm not even, at my destination, yet. So those are the reasons why the award was created, and I am so really delighted that we are really fulfilling what we are set out to do. So I do welcome you all, and this is, as Cheryl had already said, is a series, of many to come, and it's part of being a winner. Really, you're not just a winner, but really and truly, you're even going to have more to show for being a winner of the National Healthcare Awards. So I just want to say welcome. Let's enjoy the day. Let's take as much as we can from Fiona and Nora, our distinguished speakers today. And Cheryl has kindly introduced them. So I'm not going to be doing that any longer. So I shall surely handle. Oh, okay. I remember my next action. We shall all be introducing ourselves. So I would love to meet you virtually, know more about you. So if you just want to go, I'm going to mention names so we can be much more organized. And please, if I don't pronounce your name properly, I need you to teach me how to pronounce it because it is my responsibility to know how to pronounce your name properly. So please teach me and forgive me if I pronounced it wrongly at the first time, but I'm going to learn before I leave this platform. So I'm going to go to Esther. You're on mute. So just tell us your name, your current job, and where you currently work. And I hope I pronounced your name properly.
Yeah, you pronounced it better than I do.
Oh.
Yeah, so I work in Northumbria Healthcare Foundation Trust, and I work in mental health, forensic mental health, but these days I'm more into management. And also I am the chair for staff side in the trust. And I also have a role in Unison, that is the local branch, as the Equality International and Black Members Officer. I think that's enough.
You're very welcome, Esther. Ariel, I should beat myself up if I did not pronounce that properly, isn't it? Because we've been together for a while, haven't we?
Hi, Wendy. Can you hear me?
Yes, we can hear you.
Yes, the best way to pronounce my name is to remember the washing powder.
Right.
That's my name. Good afternoon, everyone. Ariel Lanada. I am the divisional lead for practice development and education at Oxford University Hospitals NHS Foundation Trust. I am also the president of the Filipino Nurses Association UK and the chairman of the OUH BAME Staff Network. Delighted to be here, and I am one of the joint winners of the BAME Nurse of the Year 2021. Hey, I'm very, very proud. Thank you very much.
You're very welcome. And can we have Akinola?
Hi, everyone. I hope you can all hear me.
Yes.
Right. So my name is Akinola Dewumi. I'm a biomedical scientist. I work in hematology and blood transfusion department at Liverpool University Hospital. I think that is all I can say about myself for now. Nice to be here.
Okay, we're going to come back to Pamela. Can we have Mevish?
Hello, yes, so I'm Mevish Shafi Ajibola. I'm a change consultant for North East London Clinical Commissioning Group, so the CCG. So I'm involved in all the ICS transformation across North East London. When I received, I'm extremely grateful for the award. But when I received the award, I was at a different organisation. So my role at the time was the head of organisational development at diversity and inclusion. And great to be here. So thank you.
You're welcome and congratulations. Pam, are you ready to come in?
Sorry.
Pamela?
Oh, hello. Are there two Pamelas on the call? Are you referred? My Wi-Fi is not very great, so I'm having some difficulties.
Pamela, I have on my screen.
Okay. I can't hear some of the participants very well, to be honest, and I'm freezing from time, so I'm tethered to my work's mobile at the moment. So I'll try to be really quick. I'm Pamela. I'm a health visitor by background, practice educator, and before that, midwife, general nurse. I received the BAME Award in 2019. I have in the past had awards for making improvements to practice. I'm currently working in workforce safer staffing. So that's where I'm working at the moment. So I'm not on the front line. So I'm working with HR and our senior leaders on, putting things in place to support our staff, recruitment and retention. So unlike I think that's the gentleman's name, the two speakers back, I'm a staff governor and also a staff side rep. So I do have, and a coach, so I have many hats that I wear to support our frontline staff and clinical leaders going forward. I don't know if I sound like a Dalek. I don't know if you can hear me okay.
Yes, we can hear you okay. We can hear you.
Okay.
Great. Can we have Louise, please?
Let's see if I can try to increase the volume.
Hi everyone, nice to meet you all. My name is Lewis Palmer. I'm based in I work mainly as a clinical studies officer, so I work as a researcher in Ardash, the Rotherham, Doncaster and South Humber NHS Trust. I also chair the REACH network, which is our staff ethnic minority network and I have a role 1 day a week as the EMRI, so the Ethnic Minority Research Inclusion, sorry, too many acronyms, hub lead for South Yorkshire with CRN Yorkshire number, the Clinical Research Network.
Good to meet you, Louise.
Thank you.
Robert?
Sorry, I might have missed
No, you haven't been missed. Robert?
Robert.
Okay, why were we... Right.
What does that mean?
Yes, you're in.
Hello. Well, I feel quite honoured and quite humbled hearing everybody else talking of what they do. My name is Robert Goddard. I'm a maxillofacial consultant working at Hull and North Lincolnshire. So my role, obviously, as a consultant, I was at the time clinical lead for my department. I was involved in the HUF BME network, and also at the time, and still plodding on with this, I tried this initiative called Touched by COVID. I hope everyone on the call might be able to look into it and see how they can support that. It's stalled a little bit. Some interesting podcasts for people to listen to. So that's me.
You're welcome, Robert. We don't have many of the doctors connecting like that, so that's really great. Thank you for all you do. Olu. Do we have Olu? While we're waiting for Olu to come to us, Annie? And while we're waiting for Annie as well. Right, I'm going to try this. Vanchis Warren.
You got it right.
Oh,
I'm
thank
Rama.
you. I thought you were going to tell me off, but great.
No, I'm Rama. I'm Rama Vanjeeswaran. I'm a chest physician, but I also am the COVID lead for one of the biggest trusts that got hit by COVID-19. And I'm the director of research here. And for the work we did, I was very grateful for the BAME award, but I also got the BMJ Respiratory Team of the Year award. So I'm feeling kind of acknowledged nationally, but I kind of understand a lot of the issues that have been discussed, and would be very keen to see how this plays out, because I certainly know Watford has about a 45% ethnic minority staffing group. And I know they did a lot of work at the front line. And I know there's not a lot of acknowledgement that's going on. And it'd be very nice to see what we can do to try to improve things. I've also been in the NHS for about 30 years now, and I can't see myself going. I can see myself working 7 days a week. Last night I finished at about 2 o'clock in the morning, but there is no progression. So you kind of very easily get asked to do all the jobs and everything else, but there is no leadership development. There's no offers of any of that. It's all done by your pure, sweat. And I think this is just not acceptable. And so I kind of look forward to what I can do to see how this organization can connect and start to give a voice to large volumes of people like me.
And
Thank you. That's it.
You're very welcome. And what you just said really resonates with many of us on this call today. Hence, we are here. Hence, National Health and Care BAME Awards. So it's about changing the narratives. And I always put it out there, you don't expect anyone else to help you if you don't help yourself. So hence, we need to take our destiny into our own hands to help each other. We have this network of winners and of leaders coming together to support the people behind us. And I always say people before us have done a bit for us to be where we are today. And it is our time to do something new and different. So over to you, Cheryl.
Thank you, Andy. So I'm just going to launch a quick poll. Hopefully you can see that. There's just some questions just to gauge where you are in your career at the moment. So if you can see the poll, let me know. And if you could just quickly answer for me. Okay. So, as we expected, you've got 7, 8. Just give you a couple more seconds to answer if you haven't answered already. Okay, so hopefully you can see the results there, and no surprise really. So 44% still feel that they don't have adequate support from your senior leaders, and hopefully during these sessions we'll be able to give some advice on how you can gain that. You agree? My next question then is, whoops. Can you see that question?
Oh, is this the same question?
Is it the same
sorry,
question?
or- Yes, because
Okay.
I think it, yeah.
Also, here's your check. Oh, here you go.
I'm just going to come in. I've responded, but I just want to share something, because that particular question, I just thought, oh, it's a bit difficult to answer, because I actually resigned from my job because it was that terrible. And then a month later, I found out I was the winner, which was great. And because of those experiences, I said to myself, I'm never going to work permanently in the NHS because I'm frustrated. So I'm now interim. So yeah, you can make what you will of that particular information I've shared, but yeah.
Thank you for sharing. It's very insightful, Mavish. Thank you. Okay, just going to quickly run on to the next question. Hopefully this one's different. Yep.
By whom?
I would say senior leaders, if that helps. Your management team. When you want to make decisions, are you being listened to?
I would have changed my answer then.
Would it be never?
Not positively.
Okay.
Not surprising.
Okay. Most people said sometimes, but I think you're probably being very polite there. Okay, wow, thank you for sharing that. We will look at those answers in more details and probably try and tailor what we do in our offering for you going forward. But in the interest of time, I'm now going to go over and ask our first speaker, which is Nora, to just say some few words, and then feel free to ask questions because I know she will be asking questions of you too. So over to you, Nora.
Well, thank you so very much. And it's a pleasure to be here and have an opportunity to talk to you. I just want to tell you a little bit about the Global Business School of Health, particularly tell you a little bit about our MBA, and then talk to you just about, what would be kind of your perception of barriers or opportunities that you would see in maybe joining us and doing a degree with us. So I'm the director of UCL's Global Business School for Health. we're the first business school totally dedicated to health, as far as we know, in the world. And we sit in the Faculty of Population Health. And one of the reasons that our school was created was because healthcare and health, as we all know on this call, is becoming more and more important. And the needs and the demand for healthcare services just keeps going up. And it really requires not just tinkering at the edges of healthcare management and leadership and thinking about what it looks like. We need to reimagine healthcare in some really serious ways. So a number of years ago, actually, it wasn't just the pandemic. This has been going on for a while, right? You know, we've got an aging population, lots of people with non-communicable diseases that, you know, cancer and heart disease and strokes and many things. As we live longer, people have more comorbidities. And they need more health care. So all of that was taking place prior to the pandemic. And I think what the pandemic has done is just really highlight many of these kind of issues and really some of the, you know, strains that we've really put on our healthcare system. So a number of years ago then, in 2016, UCL's Faculty of Population Health started on this journey to set up such a school. But the pandemic's really, you know, accelerated that and brought it into focus. And for us, we see really, you know, three areas, you know, that from a research side and an impact side that we'd like to really affect. Of course, it's the finances and the operations of healthcare. You know, part of the problem is that, you know, health and healthcare has often been looked like any other sector in the economy, and partly that's part of the problem. You know, it's not exactly like going and buying a pair of shoes, and the kind of need for healthcare professionals and people who are skilled is much more important than you'd find in lots of other sectors. And so for us, it's about really, you know, looking at healthcare and the finance of healthcare as an investment rather than a cost. You know, exploring things like value-based, you know, healthcare, and you know, and then on the operational side, how can we, you know, we need more health professionals, and of course we know that the workforce cannot meet the growing need. So how do we really, you know, thoughtfully, you know, use technology? How do we make sure it's embedded, onboarded, particularly when we have a workforce? And again, all of you know this, it's kind of running and dancing all at the same time. And now we're going to ask them to learn how to use and implement and put in place a new bit of kit. So you know, how do we do all that, and how do we embed that? And that really is around healthcare management leadership. And you know, one of the things, particularly, you know, on the clinical side, we often promote people into leadership positions with very little management business training, but also on the non-clinical side, you know, we assume a lot of things about our workforce. And so part of what we're trying to do in the Global Business School of Health is also think about that on a global scale. You know, I think in many countries, you know, what's really interesting about health systems is there's pretty much a different health system for every country, you know, little different kinds of nuances, but they all make a difference. And sometimes too, we tend to think that we can't learn from each other. But on the contrary, you know, there are many things that we can learn by working together and thinking together. So the other thing about the Global Business School of Health is it wasn't created to serve the NHS. It was really created to serve, you know, mankind and the wider kind of health systems and bring people together. And I think for people who are in the NHS, that's a great opportunity. It's an opportunity to be around people and to think about some of the challenges that you have in the context of other health systems, other approaches, really learn from peers and individuals from lots of different places. And it's the same thing with the staff. As we've started to hire our staff, we've tried to be really mindful of bringing people in from different health systems, different backgrounds, making sure that we really epitomize, diversity, not just in terms of culture, but thinking and processes and experiences in different, health settings. So, also people who've worked, both in the private, the public, sector in terms of healthcare. So that's just broadly a little bit about the school itself and the ethos. Of course, our big ambition is the Sustainable Development Goal #3, and that's really, to help contribute to bringing universal health coverage, to everyone. And to do that, it does take finance. It does take thinking differently. It does take using technology. And more importantly, it takes workforce development and really training, but maybe training that we haven't really thought of yet, and roles that will evolve and change. So we've set up a number of degree programs in the school. So I'd just like to quickly just tell you a little bit about them and then focus in on the MBA for just a minute, if that's okay, Cheryl. So we have a number of master's degree programs. One is in global healthcare management. And we've tried to really, again, if we're going to tell everybody to reimagine healthcare and think differently, we need to make sure that we're offering an education that helps people reimagine healthcare and think differently. So the global healthcare management program, there's not another one like that. It's a 1-year master's program, but you take 4 kind of core modules, and then you take 4 specialized modules. So we did a lot of research globally with employers, people who hire health professionals. And we asked them, really what were the 3 things, as it were, that they would prioritize, that they'd like their staff to know more about. And probably you won't be surprised, finance came right at the top of the list. Second came analytics, data science, just understanding how to use data better and more intelligently for making decisions. And the third was leadership, particularly around change management and embedding change and innovation. So we have then taken that feedback and really designed the program that way. So students come in, they get 4 kind of core modules. One of course is in kind of finances of healthcare. One is in human resource management with a real focus on equality and diversity and inclusion, because yes, that is a big topic across all health systems. And then, just learning about health systems. So there's a module about changing health systems and understanding and comparing different health systems and practices across the world. And then of course, leadership and management. And then the students can go on these pathways. So they get 4 modules then if they're on the finance pathway, whether or not they're on the analytics. So each term they take 2 and 2. If they're a full-time student, if they're a part-time student, they do less. And you can take this flexibly as well. So you can run it from 3 to 5 years if you need to. And then they don't write a dissertation because they work on a project, and the project they work on is working as a team. And we don't let the students put themselves on the team. We put you on the team, and we do that by using psychometric testing and really trying to put together a very diverse team, and then working with the students across the year as they work on the project to learn how to be a high-performing, diverse team. Because again, we always talk about that, but most of us don't really understand what a high-performing team really looks like and how it functions and how you make that work. So that's really important part. And what's the project they work on? They all work on a project, and that is developing, coming up, innovating with a healthcare improvement. And then they do a kind of a paper around it and a pitch at the end. And we think that's really valuable skill, not just to do the project, but learn how to do that kind of innovation, working with others. And then they have a smaller individual project they do. which can be whatever their interest is in. So there's that program. Then we also have one in digital health and entrepreneurship. And again, when we went out to develop this program, we hear a lot of people talking about digital this, digital that. It was astounding just to see how that had been interpreted into different universities. Some, Bristol has a program that's very med tech. Others had the things that were more health tech. Some looked like they just grabbed everything that looked like it had a little bit of technology and health in it and thrown it in there together and mixed it. So we try to use the WHO's guidelines for digital health. It's not a discipline, it's really a subject area. And so we've tried to be really thoughtful about putting together a course, but then also bringing in those entrepreneurial skills. Because whether or not you work within an organization or you're starting your own company, a lot of those startup skills are needed for really operating in this space. And then the last kind of MSc is biotech and pharmaceutical management. And again, we went for something, we're the first in the UK. There's one in France in a business school and one in Spain in a business school. We don't teach science, we don't teach health, and we teach the business of biotech and pharmaceutical management. So you do learn about clinical trials, practices and policies in these sectors, health economics, but you learn how to commercialize research ideas, how to commercialize and market pharma, capital and equity markets for healthcare and supply chain management. And again, they work on a project. So on every one of our programs, it's really a very interactive, hands-based project. And then lastly, I just want to tell you about the MBA and tell you that quite frankly, everyone on this call would be my dream MBA student. We're really looking for individuals who've got some work experience, are looking to either accelerate their career or take it to the next level. Currently, it is it's a full-time or part-time MBA. We offer it. It's got some really exciting bits I'd like to tell you about. So one is, again, you work on a project, but this time you're working with your fellow MBAs to solve a health challenge in a lower middle income country. You work with UCL academics, and then we're having industry sponsors for these programs, so companies. So just a few days ago, I was speaking to Roche about being involved in one of these projects. And you literally work kind of like a consultant, and you come up with a solution to the problem. But all of these modules on the MBA are taught by experts, in health and in business. They're taught in this module form. You get, say, for a week of strategy, a week of, human resource management, a week of marketing. And then we have what we call wrap-up week, where we bring in health professionals who work at a very high level in the C-suite to really bring those alive. So it's a really exciting program. I'm going to put our link in the chat. We're really keen to make sure that it's affordable. We have some scholarships, but if you were to apply and you felt that those scholarships were inadequate, if you come to me, I'm in the process of getting more scholarships. We want to make sure that it's affordable and doable. We'll also be offering in 23-24 a kind of more online version. But again, I'd be really keen to have a chat with any of you and understand how you might engage with us on any of these programs, and to signpost you to scholarships or how we can help make it happen. So I'm going to put in the chat just our web address as well, so that and my email. So thank you.
Thank you, Nora. Does anybody have any questions for Nora? Robert, you've got your hand up there. Go ahead, you're on mute.
I can't see in the chat where all the the links are, but I find it's absolutely fascinating that you're on this program now, because literally this week I have been making inquiries about an MBA program. And they're rushing me to sign up an online program, do it in a year, from a year to five years, and they break down their MBAs in terms of lots of different subtopics. And I have to say that I'm kind of stuck knowing what type of MBA that I should be looking at doing, because I would like to do something with a bog standard generalized knowledge within MBA. I was looking at the executive MBA because, to be honest, I'm a bit distrustful in terms of putting all my eggs in one basket with regards to the health system. And I strongly believe in to improve diversity requires representation on boards. And I want the quickest route to get onto a board as possible. In the background to that, I also tried setting up, as I mentioned earlier, this thing called Touched by COVID. And I could really do with a little bit extra information in terms of how to sort of to spark that into life. So that's more of an entrepreneur type MBA. So I suppose what I could really do with is a generalized executive MBA with a few extra sort of modules to sort of bump up some of the other areas. And I don't know where I should be going. The way you're talking initially, I thought it was the same people that I've just been through, and I find it's not. That this was Cumbria. I'm not sure if you're aware of their program.
Yeah, yes, I do know about their program.
So I'm like, I'm at that kind of stage where, quite frankly, I just want to get into to do something. I did, while in my work as a consultant, I did do an MSc, which was, I used my study budget at the hospital in leadership and health and social care. So there's a bit of a background there, but I really want to think, what is the best MBA program? What is going to be cost effective, and what's going to fit in with a working program in terms of my day-to-day jobs, in terms of being a consultant? What would you recommend? And is it that I'm going to need to speak to you offline as well, just to sort of get a better idea? Because, as I said, I'm in the process of just going, I'm going to choose something. I want to choose it within the next week or two, and just press the button.
Okay, well, I'd be happy to meet with you. I put my email in the chat, but I'm sure Cheryl could give it to you as well. Because I think it is an important decision, and it's probably one of the most important investments you make in yourself. So I think it's worth taking just a bit of pause and really asking yourself, and I give the same advice to all of you, focus on what you want out of it. One of the things that we do at the beginning of the MBA is we have a 2-week induction where we do a lot of helping candidates visualize where they're going. Do you want to accelerate your career? Do you want to pivot your career? And all of that's really important. I mean, just to let you know, when you do like a health MBA, like we have, it covers all the general MBA boxes. It just gives you that extra bonus in terms of health and healthcare, and it's more focused. So I think it's really, there's not a wrong or right answer, but it is it's an important investment. It's, as you just said, Robert, it's not even about money. Even if I give you a full scholarship, you still have an opportunity cost. It's called your time. So, it's about really sitting back, knowing what you want, and then you can go and look at these. Otherwise, it is quite confusing because you get, this one looks good and that flavor looks good. An executive might be appropriate if you're, staying in work and you can't take out a year and go off and do a full-time at one. But then you want to also understand, success rates, attrition rates, certain MBAs. It can be a long journey. So you have to know yourself as well. Sometimes I see people do things part-time or flexible, and they get about halfway through, and it's keeping that focus. And so again, it's just, there's a lot of variables. We can talk through those. And then we can look at what might be the best place for you at this point in your career, and you know what they offer. And I think, you know, it is a good degree. What differs from an MSc and an MBA is an MBA is a general business and management degree. So even if it has health or, you know, finance or something else at the end of it, it has to give you kind of tick these boxes to be an MBA. An MSc is much more subject focused, and so that's really the distinction. So and then the kind of networking experience, kind of peers that you're going to be having in the room. That's also really important part of being able to share your stories while you go through the program.
So certainly, I mean, I'm aware of that because my wife's got an MBA.
Okay.
Which she got hers from Henley, I think it was. And certainly having done the MSc, and that was part-time over 3 years. And I think a lot of people on the call probably are going to struggle to actually do full-time, apart from someone who's interim. I think it's going to be quite challenging. And so what's the sort of part-time ways of doing things? What kind of time commitments are you looking at doing? And I know you said it can go anything from 3 years to 5 years. I mean, what we're looking at?
Yeah, so again, it's how those are kind of planned out. And that's why an eMBA, which usually has a much longer kind of online component. So if that is a good way for you to learn and it gives you more flexibility, eMBAs often are pitched towards people later in their life, more you know, mid or late career. And so they will have a much bigger online component. So that's why having a chat with you, that might be a better solution than a face-to-face kind of MBA where you're expected to. Ours is in blocks, so you'd have to do at least a block a year.
How big are the blocks?
4 weeks.
So yeah.
Can I?
Yeah, sorry.
I just interject just before we're going to carry on with this conversation, and we have questions from Esra, Mevish, and Franchi's one. So what we're going to do, in the interest, because we've only got about 10 minutes left of this session, we're going to ask Fiona to come back again and do another session for us, if you guys don't mind, because this is a really important topic, I can tell, for you all. So we don't want to cut it short here. So we will put in another session where our wonderful speaker, Fiona Daniels, will come back and give her talk. Just to let you know, so we've got 10 minutes to go, but I'm going to keep going with this conversation because it's important. And if you don't mind, I'm going to ask Esra, you've got a question as well.
Yeah, Cheryl, thank you. I'll try to be as quick as I can.
No problem.
Laura, first of all, thank you for your presentation and that quick bird's eye view. My question is not so much about myself, but for the wider NHS. And just for information, several years ago, I was offered a scholarship to do MBA or an MSc. And I chose to do an MSc, more clinically based in forensic psychology, mental health, that sort of thing. If I had done the MBA, I probably would have been much richer today, but that's not a problem for me, right? So my question is this. A lot of people I see come out with their MBAs or some kind of management qualifications to work in the NHS, and they seem driven with this kind of principle to get things done for the least possible cost and without paying due regard to the principles about compassion and inclusivity, etc. And I just wonder if you have a view how we can address that on a wider basis, not a trust, but the NHS.
Yeah. Well, again, you know, partly of why we have a business school for health is because we realize patients and those kinds of aspects often are not taught in a general MBA. And so ours is much more focused on the environment. I think historically MBAs have had a much more a finance accounting focus, and ours has a much more people focus, and that's done on purpose. And I think it gets back to what I said about looking at your workforce as an investment, not as a cost. And I think, you know, COVID, of course, has hit, healthcare, but it's also hit society in some really serious ways. I think places like the UK feel a little uncomfortable now with the idea that people in low-income areas, such as East London, have been particularly hit very, very hard. We like to think of ourselves, as egalitarian societies. And I think it's really exposed some of the social uncomfortable determinants of health that weren't being addressed. And so I think that will just in general has kind of created a much more, a bigger desire across, I think, all business schools, not just our business school, for social impact, thinking about those very things that you said, recognizing, it's not just healthcare, all businesses are really people. Organizations are all about people. And so I think, I would like to think that is really going to inform much of what we do going forward. But I can assure you, when we've been putting this school together, these various programs, we put a lot of focus on the people side. And we talk about change management. And as I said earlier, I had someone in the NHS say to me, Nora, the problem isn't innovation. It's not a lack of ideas. We're just all exhausted. And it's really hard to get people to, constantly be changing in that environment. So, I think it's understanding the context that change takes place in. I think it's creating good leaders that are listeners. I think the best leaders are those that really listen. And sometimes that can be difficult, So I wouldn't, wash all MBAs as just financially driven. I think that is really a problem across healthcare, and trying to see healthcare like we see other businesses, and not recognizing. I really see two sectors that have a lot in common. One, I'm in education. Education is a people business, okay? And healthcare. And that's why both of them need to be seen not as creating costs for the society or costs for government or, driving up, but as investments. Because when you take those two together, that's really what creates productivity. That really creates a healthy society. So thank you for that question.
Thank you, Nora. Rama.
Yeah, I kind of had quite a lot of questions that Robert had, but I think the idea that the question I wanted to ask, I've got 3 kids that are all going either to university or whatever, approximately indicative costs. What would it be for a MBA? I like the idea of the EMBA because I'm much older, as in I don't think I'm going to retire for another 12 years, but it would be nice to spend the latter part of the year kind of making an impact and doing something of value. So I do think the investment is worth it, but I don't know how financially expensive this is going to be, especially when I've got 3 kids.
Yeah, so the MSCs are much more affordable. The masters, they're a different experience. They're around, and I don't know the exact, but around 16,000. And then, if you get a scholarship, you can bring them down to something more around 10 grand. The MBA is expensive, and that's why what we're looking to do on the EMBA, and that's why I'm raising scholarship money, is to bring that down to about 50%. So it's still expensive at 50%. It's 45 grand to do an MBA in health, the face-to-face. The EMBA will be about that amount. And we're looking to have scholarships up to a full scholarship, so that you could apply for a scholarship and have all your tuition paid. And we've got some scholarships now that offer about £15,000, but yeah, it's a whole different kind of an experience though. And you have to understand that that's not actually, that's on the low side of an MBA for a school like UCL. So I know that seems eye-watering to anyone who's never paid that kind of money, but the kinds of careers that people go into from those MBAs and the the kind of investment that we put in to the students. So everything is really career coaching, mentoring. As I said, you work on this, you work on a global project, you go for 2 weeks a field trip, to another country. But there are scholarships. So I don't want that to be a barrier. And that's why I'm working so hard to get scholarships.
So here's the challenge I'd push back to the BAME awards. And we are supposed to have been clinical leaders. There should be investment in leadership training. The NHS clearly needs folks like us at the front trying to energize, empower, and get the NHS a better place to work in. It shouldn't have to be at the cost already of our families as well to educate us for a benefit that would be very valued to the healthcare population. So my pushback is, why can't this be a grant or something from the NHS for ethnicity development and everything else? And that would encourage people to apply for the awards, and it's a meritorious regime where we don't have to struggle to pay for it. I mean, I'm always in the red in my bank account. I can't see this happening. And because I'm a consultant, there's no way my children would get anything but a student loan, and they're all on student loans. So it seems really rubbish at the latter part of my years, because I want to help my folks, that I pay for it as well. So may I push back and say, why can't we get a big grant from Boris to say, look, we've struggled, we've suffered, we've lost lives. Can you not give some funding to develop us? Because all the Caucasian leaders in my organization are getting leadership development for free during working hours. Why should we pay?
Thank you.
Yeah, I can't echo that enough, because I do know that the NHS, by the way, sends people on premier MBAs. So somebody's going on those. I will say to you, I'm hustling very hard to raise, a substantial amount of scholarship money. I will get that done, but I do think that you're raising a very important point there.
I really think if you look at the scarcity of BAME leaders in the organizations and the lack of facilities, this is where the government should invest. Start with the BAME awards and give it to meritorious awardees and start to develop them.
Can I just say
Thank
something before I burst with it? I'm so sorry to jump in. I've been listening to this fantastic conversation. So, I really want to explore this even more, but I just want to just add a couple of things, because sitting here, I don't work in the sector, but I do sit on a board and hopefully coming up a NHS trust board. So this is all really, I'm really passionate about this area. So there's a couple of things for me, because I think the challenge that Rama is raising is an absolute valid one. Because what tends to happen is that, I'm private sector 30 plus years. And, all of this is supported in the private sector. I don't have to pay for an MBA myself. It would be supported by the company. And obviously I know the differences between the private and the public sector. But there's another bit that's a little bit before this for me. And that's around the fact that Rama mentioned, which is we already have within the NHS a number of leadership programs that currently exclude our ethnic minority population for a number of reasons, whether that will be because of the way that talent is distinguished, whether that's how performance ratings are done and all those things. So it kind of pushes people out, and so the same people just get put in. And because of that, it then means that because the same people who look a certain way then have access to these programs, rather than changing that mindset, what happens, which I see a lot across the NHS, is we then create BAME programs. We then create specific programs for BAME individuals, which worries me because it's saying to me that we're not going to give you the leadership capabilities that everybody else is having. We're going to give you something else that we feel that your population needs. And then when you try to navigate to the top, it's, we haven't got these things. We haven't got them because you're not letting me do them. So I can't get onto them in the first place. So I think as well as these great MBAs, we've got to understand what are the barriers that are stopping people from doing the leadership programs, including the Black, Asian and ethnic minority colleagues, into the current leadership programs and equipping them with the skill set to lead people. All the things you talked about, that can't just be done through a program. It has to be done in the context of the workplace. And we have to enable the access to happen for individuals without the need. We don't need new programs just for specific populations. We need the same access to the programs that people are already getting on that puts them at the seat at the table. And I want to talk about even more when I do my next session with all of you, because I am bursting with all of this stuff.
No, because
I find it so frustrating.
The networking opportunities which enable the like recognition to enable leadership development is what we're not getting. I've already paid, I already paid myself and went on a certificate for leadership development and then ran out because I can't afford it. And why should I have to do this? Well, I've got 100 publications. I've done so much. I've got a BMJ award.
Yeah, exactly. You know what I mean? What more do you need to do to get into the very same thing that is blocking? You know, it just doesn't, my head doesn't compute such stupidity. It just doesn't make sense. Go on, Robert, I'm sorry. And I know that...
Can we quickly have hearts and minds as well as systems and processes? And Fiona's right about bringing people together, not separating, because we want to all learn the same. We're doing the same job. We're working for the same outcomes. So we should be really accessing the training together. And furthermore, we should be doing it, the training should be linked to exposure to the working environment. So if you're doing a leadership course, you should be working in a leadership position alongside someone in leadership position. So a bit like the NHS Fellows program. So you're getting paid for doing that level of work and you're getting that exposure at the same time, as well as learning. Because when we look at the research for, if I use the term BAME individuals, they are the most highly qualified. And most of us, I did a small scale study, and from my study, the staff that were on that study all had not just a degree, but they had masters as well, and some had much higher. So they already have that high level of qualification. What they need is the opportunity to progress.
We're not connecting the talent to the opportunity.
Sorry, can I just jump in there? Sorry. Mevish has been waiting for a long while to have her say, and then we're just going to quickly go to Robert, and then we will close because we're out of time, I'm afraid. But we will pick this all up again at our next session.
Thank you, Cheryl. I was patiently waiting. I was thinking, guys, I need to go to a meeting, please. But my only thing is, and I think it's just making myself known to Nora rather than a question. And I'm very open and transparent, and I think that's what's gotten me the successes. I don't come from an educational background as such. You know, I've achieved what I've achieved on my own. Yes, I've got a law degree. Everything I've paid on my own. I was the only one who actually achieved a degree in my family. So my family economics weren't great. I came from a particular background. I am where I am. I have 2 young kids, a 2-year-old and a 7-year-old. I was an 8B in the NHS for 7-8 years. but I was working at a very senior level for a very long time. And the successes that allowed me to graciously sort of receive this award was at an 8B level, but I was very much working at a very senior level. But the great thing was they let me lead. So I was able to have the full reins of making things happen. And as a result of that, successes were achieved. And the reason why they allowed me to lead was because they didn't know what to do because it was EDI and oh my God, it's so scary. So because of all of that, I achieved what I achieved. My reasons for sharing that is because when I realized that things had died down and there were certain behaviors that were coming out, which clearly allowed me to understand my abilities, that I realized I don't need an education. I don't need any of this, where I was trying to box myself into certain, the lack of, I don't have this, I don't have that. Therefore, oh, of course I can't get to a certain level because I don't have it. But in the last few years, I've realized I do have it. I don't need the education. Saying all of that, and by the way, I'm an 8D now. It just shows. I'm an 8D now, and I'm leading a whole transformation program. So for me, and I have those opportunities, but I had to go through what I had to go through. So despite what I've just shared, I see the value of education, and I see the value of kind of getting to that next level, in particular healthcare, because I'm actually frustrated the fact that vaccination in particular, no one's going to be free of COVID if we're all vaccinated. We know that from what's happening with Africa. They're not getting all the vaccination that they need and deserve. So I think from that perspective, I understand that global position. So I think my reasons of sharing all this, and by the way, just to let you all know, I'm a res expert. So I know everything, Fiona, what you've shared and those conversations. So I'm not going to go into all of it. So my thing is, I want to do an MBA. I know I can make it happen because I've got that need and sort of desire to do more, but I can't do it without full scholarship. And that's what's held me back, because I cannot do it. Like financially, I cannot do it. And I'm not going to put myself in a position only now. And a band 8D is senior. Only 2 years ago, I finally was able to, as a family, buy our own home. I'm not putting myself into a further sort of financial burden. So I think I'm putting it out there. Nora, if you get any funding, I'm here. Call on me, but I will email you and I will get hold of your email address. I've got to now go and do a meeting with a lawyer.
Thank you, Mavish.
And I just want to make all of you a promise. I am working very hard, and I know that we will have scholarships. And I recognize that, I've seen people who came 2-3 grand from being able to afford it. And that is just criminal when we get that close and somebody has to walk away from doing a degree. And I also don't think that, there is a bit of cachet that comes with going to a place like UCL. It is an incredible experience, and it shouldn't just be for a few. So I just want you to all watch this space. We're going to have an EMBA. Robert, keep an eye on that. It will launch in 23, and we will have scholarships. I know right now I could name a company I spoke to this week, and they want those scholarships for BAME candidates.
Thank you. I'm going to add something else for everyone else. When I realized that I was capable and confident and I don't have a lack, I started applying for board positions, and I have some lined up. It's interesting though, Fiona, you're clapping, which is great, bless you. But it's interesting, they all made it very clear it's unpaid. But I'm okay in doing it if I'm successful. But again, it just shows, so I can get the opportunity. I can do, my skills are valid, but enough to pay me. And I think those are the things we know from all the evidence we've got. But thank you, everyone. I'll see you soon.
Thank you, Mavish. And very, very last comment. Did you have a very last quick comment, Robert, before we close this session?
Yeah, there's loads of things I want to say, but I'm not going to say hardly any of it. What I will say is that we spoke about networking, and there are networks out there. There are black networks, BAME, whatever you want to call us. There are some some very well-positioned people. It's getting into those kind of networks. And we actually are a network already. So, you know, I know this is supposed to be that we're dipping in here, but what we're really saying is we need this network to actually continue. We need the networks in order to be able to say, well, actually, where is the signposting for education? Where's the signposting for it? I'm on a WhatsApp group that someone introduced me to, and I'm a bit ashamed of it because I'm getting so much stuff about jobs all over the place in different sectors. Fantastic, right? But we need to create that ourselves. With regards to, this is the last bit, with regards to the idea of having educational and experience hand in hand, this is what I brought up with my trust, and it's really been quite badly shot down. People going, yeah, we'll do it, but it doesn't move. I said you effectively need a sandwich. You need to have a bit of experience, you need to have some form of qualification, and you need a little bit of experience after the qualification. All right, and thereafter you're on your own. At least you've said, I've ticked the box for the qualification, I've ticked the box for the experience. Now let me go. And I suggested that should be partly funded by the individual themselves, by saying, you know what, if you've got a shadowing type thing, a couple of weeks of holiday, you have to give it up. All right, to help pay for that. All right, but likewise, that should be matched by the organization in terms of study time. And if we did that, I believe that people would, you get more diversity and you get more progression. I did my dissertation on MSc was basically BAME representation in leadership in the NHS, and it discussed the likes of what are the barriers to progressing. And I have to pinch myself because I have to sometimes keep on reading back what I actually wrote because it's still very, very relevant. I'll probably share little bits of it in future meetings, but I think it's really important. And the last bit, in terms of financing, I agree wholeheartedly. We shouldn't be looking at getting these kind of ethnic style qualifications that are not regarded amongst anybody else. What are you really going to do with it? I got something from our EDI type network to say, oh yes, apply for this and look for bursaries. You apply for a bursary. I can't apply for a bursary as a consultant. I'm not going to get anything. But likewise, then there are people who won't apply for no one applied for the bursary. So no one applied for the bursary because they didn't feel competent to do it. And those that feel competent to do it, they're regarded as not having the money for it. And with working within the NHS, it's the time issue, more perhaps than to some degree than the financial issue. You know, a block of 6 weeks in a year, I can't take. I've only got 6 weeks holiday in the year, full stop. But I could make, you know, if it was like a day a month or something like that, I can do something like that. So that's why I was really questioning with regards to these programs, what kind of face-to-face elements are there, especially in light of we are NHS professionals who work in the NHS. There's no way in this pandemic and trying to get a recovery that they're going to be saying, oh, take 6 weeks off. Not a chance.
Yeah, thank you. I mean, gosh, such powerful words there. Thank you, Robert. Wendy, I'm going to let you close, but just before we go, we will have additional sessions now based on all that you've said. And as I said, Fiona's going to come in and do one as well for you. And I'll let you know the dates. If you have any further topics or questions that you would like us to cover, please do email me. You have my email address now. You can email me and we'll try and set those up for you in the new year. But with that, thank you all for coming. And Wendy, just over to you. Say goodbye for just today.
Much, Cheryl. Everyone, I think I'm speechless, basically, even though you've all identified something that is not necessarily new, but these are the challenges that we are going through in the system. And it's good to identify those, but then it's also good for us to now look at the solutions. So we really need to be solution focused. Great, insightful discussion. You know, I could see Fiona's energy, and we need to please just keep it to the next session to bring it. So we need to really have Fiona back, and I shall surely be looking forward to that. It's been an honor, a great honor to spend this time with you all, and thank you very much, Nora. You know, absolutely, you know, great information. And MBA is actually on my list of things to do. So when I get that sponsorship, I shall surely.
Okay. All right. I'll be looking for your application, Wendy.
Yes, please. I shall surely jump at it. And I just wanted to put it out there that, you know, it's a great network, Robert, and you're very right. And it's going to develop into a massive network of leaders of ethnic minority or BAME or BME, whichever one you're comfortable with, you know. Just to say to you that one thing that the Health and Care Awards will also be doing in part of developing future leaders like you and bringing all those leaders under one roof is how they are very short, as they say, and I'm quoting them, you know, that they don't know where to go to get speakers from the ethnic minority background. So they will be coming to us. They will, you know, to showcase you on national conferences, you know, regional conferences. So we really have what it takes. It's about placing ourselves well, and it's about, you know, being strategic about things, identify things, having a safe place to discuss this type of issues and bringing the solutions along. What can I say? It's been great to spend this hour. Rob.
Sorry, can I just ask, could you possibly look to send out some kind of survey to find out what would be the appropriate time and dates for various future meetings? I mean, presently, this is a lunchtime thing, and I'm just about able to do this, but usually I work all the way through lunch, and I'm not sure if anybody else will feel similar. And obviously, I can't be expected to be attend every occasion. I wouldn't expect people to be putting themselves out just for one person not being able to be there. But I think it'd be nice if we could get into some kind of regular sort of meetings like this, and to think about what's the best times that's going to suit the most amount of people. You can't please everybody, but for the most amount of people.
Yep. Thank you very much.
Yes, of course.
It's great. We will take that feedback on. Van.
Hi, I think we have two ethnic minority leaders in government, one being Sajid Javid and the other one being Rishi Sunak, who owns the power, the purses. You've got an award scheme where you've checked out. Is there no way we could get them vaguely connected in with this? They have leaders of industry, but they can also start to think about how to support the development of people who are interested in this kind of work, because I'm sure there is funding that they could, or funding, opportunity, everything, but they've gone through it. They should know how they got through it, but what they would do to support people who didn't go to Oxford and Cambridge and didn't have the money for those kind of educations or networking.
Good, yes, a very good points. Again, we can exploit that. But I must say, I'm sure many of you do know about the Leadership Academy, and they do run quite few leadership courses as well as for ethnic minority. You know, so again, we can exploit that because actually they've been in partnership with us. But again, due to the pandemic and restructuring within that organization at the highest level, you know, things did not move as planned. But it's a very good point that you've raised there, and we shall surely, and with Cheryl and the team, and to exploit that.
I'm keen to take up Fiona's thing where we are pulled into the national programs as opposed to an ethnic specific program, but you've got an access point that is slightly different. So it doesn't require the existent structure to identify you, but it pulls you into the same development.
Yes.
Yep.
So
Thank you, everybody. Thank you. It has been such a great discussion, and I will take on board, Robert, what you said about asking everybody what the best time is for them. So look out for those emails, they will come. Please try and join the next 2 sessions in the new year if you can, though, because I think these discussions are really important. But it's really great to see you all today, and we hope to see you again soon. Have a good festive period.
When is the next date?
The 11th of January.
Fantastic. So see you in the new year, and Merry Christmas.
Thank you,
Yeah,
everyone.
Merry Christmas. Thank
Merry
you.
Christmas.
Take care.
Keep safe.
Bye, everyone.
Bye.
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 Bye.